Hi, I'm Greer from Active Health Clinic. So today talking about what is a natural breath or understanding our natural breath. So as we know, we can breathe based on just unconscious work of our autonomic nervous system. And we can also breathe with conscious control. So there are many ways to breathe. When we're breathing based on our body's demands, it's going to be driven by our oxygen levels and our carbon dioxide levels. So naturally, our diaphragm will be sitting quite relaxed in a dome, and we breathe in, bringing in our oxygen, taking that oxygen over to our blood that travels around our body, and we breathe out carbon dioxide. So eventually, as we breathe in, the carbon dioxide levels, they're going to rise and tell us when we need to take another breath. And just like this, it goes on and on and on. What can happen sometimes is, well, we all have a natural pattern for our own breathing or habitual ways of breathing. And so often we talk about in our sessions and we talk about it just in general. So often we get into shorter breaths. And this is where we may not be using that diaphragm in the most efficient way. And this is normal, we all do it. And in times of stress, that's normal. But what can happen is it can lead to us over breathing a little bit because we're not getting maybe the ideal breath in. We try to take on more and more air. So I just wanted to touch on that today. And this idea, as well, as we talk a lot about in clinic, is if we have things like ongoing fatigue, persistent pain, POTS OI, our body is that little bit more susceptible to perceiving threat or perceiving stress. And stress is our body changing the way it's breathing. Stress is breathing faster. That increases our heart rate. We take on more oxygen. So it leaves this breath being a little out of balance. It's functional. We still are just fine, but it's a little out of balance. So I wanted just to highlight that today. And then the next video or other videos, I'll talk about what we can do about it. Thanks.